Hello everyone, I'm Aaromal Satheesh. I hope all of you are safe and healthy. First of all, thank you so much for all the love and support you showed to my previous videos. I saw a lot of queries coming up in the comment section as well as in my Instagram regarding Pharm-D. Sorry I couldn't reply to each and every one of you. Hence I thought of coming up with a video so that I can at least answer a few of the commonly asked questions. So most of you inquired about the job opportunities after Pharm-D. So in this video, I'll be talking about the same. So this video is just to give an overview or some basic information to those who don't have any idea what to do after Pharm-D. If you are an experienced person who is watching this video, you may not be satisfied with my explanation because I'm not explaining anything in detail. But again, if you have an expertise in any of these fields, please provide your suggestions, your thoughts or inputs in the comment section so that it will be helpful for the freshers. So coming back to your question, what to do after Pharm-D? Well, I classify the job opportunities or options into three categories. The first one is a hospital-based job wherein obviously you have to work as a clinical pharmacist. But other than a clinical pharmacist, you also have the option to work as a hospital pharmacist and also as a clinical trial coordinator. And the second option is the corporate jobs. So in this, it includes the pharmacovigilance, the clinical research, the clinical data management, the regulatory affairs, the medical scientific liaison, marketing, etc. And the third option is academics, teaching or research oriented jobs, and also starting up your own business. So the first option, hospital jobs. So ideally, after completing Pharm-D, you can start your career as a clinical pharmacist, and that's what you're studying for 6 long years. So the word clinical means humans. You are dealing with humans. You are working for the patients. You are a doctor of pharmacy. You are someone who is representing the pharmacy, who has really good and sound knowledge about medicines, about drugs, and you are in a position to suggest medicines to the doctors based on the patient condition. I'm not going in detail about clinical pharmacists. This is not the way to explain about clinical pharmacy. I really wish I would come up with a new video wherein those who are working as a clinical pharmacist will come up and share their experience. What are the day-to-day activities? What are the challenges they are facing? So that you will have a better idea. So stay tuned for that video. So coming back about the salary. So in India, as a fresher, as a clinical pharmacist, sadly your salary sits under 25,000 and it slightly increases with your experience. But with 2 years of clinical pharmacy experience and you manage to clear the health authority exams of Arab countries like the Prometrics, the DHA or MOH, then you have the chances of working as a clinical pharmacist over there with a pretty much decent salary, that too in 6 digits. But the problem is that because of this increased number of graduates for these limited vacancies, this opportunity is getting saturated. So now you will ask, what is the status of clinical pharmacy in foreign countries? But I really don't want to discuss that now because it's a big topic, but definitely I will include this in my upcoming clinical pharmacy video. And now, suppose if you are not finding a job as a clinical pharmacist, but you are in a situation wherein you have to really support your family, then you can think about other options. So the other options include hospital pharmacist and a clinical research coordinator. Again, I am not encouraging any Pharm-D graduate to become a hospital pharmacist or a clinical research coordinator. As a Pharm-D graduate, your main aim should be to become a successful clinical pharmacist. So I am just giving an idea about the other options, about the other hospital jobs. So as a hospital pharmacist, you'll be more into the formulation, the dose division and dispensing of medication in a hospital setup. You won't be having all the rights of a clinical pharmacist. You won't be able to suggest medication to the doctors like that of a clinical pharmacist. And also the hospital pharmacy experience cannot be considered for a clinical pharmacy job. That means the hospital pharmacy experience is not equal to the clinical pharmacy experience. But again, you will have a decent pay, especially in the Arab countries. So coming to the second option, the clinical research coordinator. So in a multi-speciality hospital, there will be a lot of clinical trials happening. So as a clinical research coordinator, you will be coordinating the activities of a clinical trial, which includes helping the doctors to find the patients for a clinical trial. Then you'll be calling the patients and reminding them about the upcoming hospital visits, taking them to the laboratories, collecting the samples, dispatching the samples, and documenting all the lab reports, etc. So basically, Initially, as a clinical research coordinator, you won't be earning much, but after graduation, if you're not finding any other job, this will save your time. This will give more exposure to the clinical trial, and you'll be having a better understanding about the clinical trial process. So if you don't find any job, and if you really wanted to work in a hospital, then start as a clinical research coordinator, and in the meantime you can try for a clinical pharmacy position or any other fields, but don't waste your time sitting at home. So now coming to the highlight of this video, corporate jobs. So before talking about the different options in a corporate sector, you should be having an idea about two things. The first one is the company or the workplace you are going to work. So there are core companies as well as contract research organizations. So what is the difference between this core and a contract research organization? The second is a clinical trial. So all these corporate options is somehow connected to a clinical trial. So you should know why and how a clinical trial is conducted, how a drug is launched in the market. So coming to the first point, the companies or the workplace. So as I said, we have the core companies. So all the multinational companies like GSK, Novo Nordisk, Novartis, Eli Lilly, these are called the core companies. And these companies will outsource some of their work to a research organization on a contract basis, which is called as the contract research organization, which includes Bioclinica, IQVIA, Clinipace, Parexel, etc. And there are a lot of difference when we compare the way of working in a core company with a contract research organization. And one of the main difference is that in a contract research organization, you have something called micromanagement. So micromanagement is nothing but like you'll be having some daily targets, and at the end of the day your team lead or your manager will be having a check on you whether you have completed all the tasks and you are answerable to them. But in core companies, in most of the cases, you don't have that micromanagement. Of course you'll be having the deadlines, but you have little more convenience, you have little more flexibility. So I would say in a core company, the work pressure is less and you have little more flexibility, but in a contract research organization, you have more of work pressure and the flexibility will be less. In a core company, your pay will be more, but in a contract it will be less compared to a core company. So obviously working in a core company gives you a little more freedom, little more work-life balance compared to a contract research organization. But it is a bit difficult to get a job in the core companies. They usually select candidates either through campus placement or through the referral programs. So for a fresher, the only way to get into a core company is through campus placement. So that's what I mentioned in my previous video. So whenever you are selecting a college, make sure that the college is having a good placement cell. But suppose if you fail to get through a campus placement, or you started your career in a contract research organization, there is nothing much to worry about, because the training you get there, the work you do, everything automatically improves your skills. It improves the skills of multitasking. You become more flexible and adaptable. Then later when you move to a core company, then things will become much easier for you. So it's absolutely fine if you work in a contract or a core company, but yes, the work-life balance will be much better in core companies. So the next thing is a clinical trial. So these clinical trials are conducted to make sure that the prescription medicines are safe and effective in patients who use them. So it is mainly conducted by these biopharmaceutical companies, the government bodies, or any non-profit organization. So if you look into the drug development process, initially the researcher or the scientist will develop or discover this drug molecule, then they will design it to treat the target disease, after which they will conduct a lot of experiments. After that, the drug will go into rigorous preclinical and clinical studies. Now the report of all these preclinical and clinical studies will be reviewed by the regulatory body of the nation. So they will check whether the drug is having more benefits than the risk, and only if they approve, the drug will be launched in the market. So all these processes will not happen in a week or a month. It will take years, like 10 to 15 years to launch a drug in the market, unlike if it's for some pandemic like the vaccines for corona. So the doctors or the clinical pharmacists, they treat the patients with the drug drug that is already launched in the market. So how these drugs are launched, they should go through all these complex process. And who runs the complex process? There lies the importance of corporate jobs. So in this process, after the preclinical studies, in order to test the drug in humans, the company needs to file an application called IND, or Investigational New Drug Application. Similarly, in clinical studies after phase 3, in order to test the drug in a larger population, that is phase 4, the company again needs to file another application called NDA, New Drug Application. So both these IND and NDA comes under regulatory affairs. So the company's regulatory affairs department will be working on it. Similarly, the CRAs and the clinical data management team have their roles throughout the phases of these clinical trials. The PV or the pharmacovigilance monitor adverse drug reaction throughout the clinical studies. The medical scientific liaison or the medical scientific team, they conduct healthy discussion with the key opinion leaders about the upcoming drugs based on scientific evidence to improve the scientific activities. The marketing or the sales team, they promote the sale of this particular drug among healthcare professionals. So if you see, all these corporate fields have a significant role right from the development to even after the launch of a drug. So now I'll give a brief idea about each of these corporate job options in my next video. Till then, take care, be safe. This is Aaromal Satheesh signing out.